The quality of life and stigma experienced by rare diseases and their families in Romania. A rare disease is defined in the European Union as a condition that impacts less than 1 in 2,000 people. Whilst rare diseases are largely heterogeneous in presentation and origin, the burden that these have on families and children has been identified, including physical, social, educational, and emotional difficulties. Further, many patients with rare diseases cannot access treatments due to their inadequate availability, accessibility, affordability, and acceptability. As of 2010, rare diseases affect approximately 1 million people in Romania. Nearly 3% of Romanian children have a rare disease. However, the current literature on rare diseases in Romania focuses on access to medicines, etiologies, and the outcomes of specific conditions. As such, there's an urgent need to develop increased further information on this population. An online Qualtrics survey was conducted as part of a larger research study capturing data from 80 participants with 41 rare diseases. The 29-question survey was composed of demographics and 2 validated questionnaires, the Pediatric Quality of Life and an Adapted Parental Perception of Public Attitude Scale. Participants were recruited through treatment centers such as the Maria Beatrice National Pediatric Center, through social media, and through rare disease patient organizations. The main finding of the study was that a correlation was identified. Parents who experienced high levels of perceived stigma were more likely to report a lower quality of life for their children with rare diseases. There were some occupational implications as well. 83.75% reported that their children could not do things that other people their age could do. 75.4% and 71.25% of children missed school or events because they had a doctor or hospital appointment and because they were not feeling well, respectively. 62.5% reported that their children often or always experience low energy levels, and most also experience pain. Occupational therapists are uniquely located to help address these key findings in order to lower the perceived experiences of stigma and improve the quality of life of patients with rare diseases. Occupational therapists throughout the literature have successfully developed educational interventions to address self-stigma and improve community understandings of health conditions. In partnerships with others, such as schools and religious communities, occupational therapists can foster improved understandings of rare diseases. Further, occupational therapists are well placed to assess the physical and psychological needs of children and advocate for improved reasonable adjustments, increased access to rehabilitation, and support environmental modifications. In addition, occupational therapists are uniquely skilled to provide family-centered interventions, helping families learn about their child's diagnosis, feel included in their care, and work towards greater occupational engagement for the entire family. Lastly, occupational therapists are skilled at providing pain, fatigue, and disease management intervention programs, which can help ensure that they are present more in school and social settings. Nevertheless, it is essential to note that occupational therapy in Romania is currently only available in private or charitable sectors. So the primary implications of this research is that there is a need for increased access to occupational therapy services in Romania.